Good morning, friend. Today we will discuss an important topic, that is enzyme pattern in liver diseases. The first important enzyme in liver diseases is ALT. The another name for ALT is SGPT, that is serum glutamate pyruvate transaminase. The enzyme commission number is 2612. It belongs to the transferase class of enzyme. This is transaminases require pyridoxal phosphate PLP as a coenzyme. The normal level of ALT is 5 to 35 international unit per liter, and in infective hepatitis or hepatocellular jaundice, the concentration increases near about up to 1000 international unit per liter or more than that, that is 2000 3000 international unit per liter. This is a intracellular enzyme. This one is a plasma non-specific enzyme, and their concentration is more in the cell as compared to the plasma, but whenever there is necrosis, proliferation, damage and neoplasm of the hepatic cell, hepatocytes, their concentration in the hepatocyte increases and leaked out into the plasma and detected. So this is the enzyme which is more specific for the liver diseases. Coming to the second important enzyme, that is AST or SGOT, serum glutamate oxaloacetate transaminase or aspartate transaminase. The enzyme commission number is 2611. The normal level is 8 to 20 international unit per liter. It is distributed in cytosol and mitochondria of liver and heart. It is not specific for the liver as compared to the ALT because its distribution in the heart muscle. That's why the concentration of SGOT also increases in heart diseases. So it is increases in heart diseases and also in liver disease, especially in infective hepatitis. And in alcoholic liver diseases, that is alcoholic liver diseases, the concentration of AST increases more as compared to the ALT. This is because of its mitochondrial distribution. In alcohol injury or alcohol induced injury or in alcohol metabolism, there is production of acetaldehyde, and this acetaldehyde damages the mitochondria and causes the release of AST. That's why the AST level increases in alcoholic liver diseases, and AST-ALT ratio is more in alcoholic liver disease. So ALT, it is specific to the liver. Concentration increases in infective hepatitis 1000 times of the normal, up to 1000 times of the normal. AST concentration also increases up to 1000 times of the normal, but its level also increases in heart diseases, for example acute MI, and AST levels are more as compared to ALT in alcoholic liver diseases. So this is the second. Now coming to the third, that is alkaline phosphatase. Alkaline phosphatase, this is an important enzyme to differentiate between hepatic disease and obstructive pathology. The important part is this is a ectoenzyme present on the cell surface. There are 6 isoenzymes of ALP. The first one is the bone, also known as pre-beta, then placental, also known as alpha 2 heat stable, then biliary, that is alpha 1, then hepatic, that is alpha 2 heat labile, then in intestine it is gamma and leukocyte alkaline phosphatase. These are depending upon the source. They are classified as bone, placental, biliary, hepatic, intestinal and leukocyte alkaline phosphatase. This is with electrophoresis, that is pre-beta, alpha 2 heat stable, alpha 1, alpha 2 heat labile, gamma and leukocyte alkaline phosphatase. This concentration of this increases, that is pre-beta or bone isoenzyme increases in bone diseases, as it shows the osteoblastic activity. The concentration increases in Paget's disease, rickets, osteomalacia. Then this placental isoenzyme, its level increases in carcinoma of the lung, liver and intestine. And that part of isoenzyme is known as Reagan isoenzyme. Then this biliary increases in obstructive jaundice, and this hepatic increases in hepatocellular and obstructive jaundice. Then this one is the intestinal isoenzyme and leukocyte alkaline phosphatase. This concentration increases in lymphoma. This is the common form, constitute about 50% of ALP activity, and this hepatic constitute about 25% of the ALP activity. Now coming to the diseases in which ALP level increases. In infective hepatitis or hepatic diseases, the concentration of ALP increases slightly, that is 2 to 3 times of the normal. Okay. And in obstructive pathology, that is obstructive jaundice, the concentration is 10 to 12 times of the normal. This is because, and this is the important part, as it is a ectoenzyme present on the cell surface, it is present on the biliary canalicular surface, and whenever there is obstruction to the bile flow, that bile flow irritates this outer surface of biliary epithelium, that causes the release of ALP into the circulation. So it is a ectoenzyme present on the biliary epithelium because of irritation due to obstruction to the bile flow. Okay, got it? And 25 times of the normal activity it is seen in bone diseases. So this is about the alkaline phosphatase. Now coming to the fourth enzyme, that is 5' nucleotidase. The concentration of 5' nucleotidase, it is normal in hepatitis, but whenever there is intrahepatic or extrahepatic obstruction, or whenever there is obstructive pathology, the concentration increases. And next one is the GGT, that is gamma glutamyl transferase or gamma glutamyl transpeptidase. The concentration specially increases in alcoholic liver diseases. So ALP 5' nucleotidase and gamma glutamyl transferase that indicates the obstructive pathology, whether it is intracellular or extracellular, whether it is intrahepatic or extrahepatic, and ALT and AST represents the hepatic cell damage. Now coming to the difference between that hepatic jaundice and obstructive jaundice. In hepatic jaundice, the concentration of ALT, AST increases much more as compared to the other enzymes, and ALP activity, that is alkaline phosphatase, that is 2 to 3 times of the normal, that is slight increase in ALP activity, and nucleotidase and GGT levels are remain normal or there is slight increase in the activity. But in obstructive jaundice, whenever there is obstruction to the bile flow due to the stricture or CBD stone or common bile duct stone, or whenever there is obstruction to the bile flow by the carcinoma of the head of pancreas, then in this situation the ALT and AST levels are normal to slightly raised. Alkaline phosphatase, it is increased 10 to 12 times of the normal, that is marked increase in the activity of alkaline phosphatase. Also there is increase in the activity of 5' nucleotidase and gamma glutamic transferase. So this is the basic difference between these two, hepatic jaundice and obstructive jaundice, with reference to the enzymes. Okay. So we will discuss one case related to this topic, that is enzyme pattern in liver diseases.